The Executive Director, Uganda National Health Consumers Organization, Robina Katiritimba, has asserted the presence and setup of teams in institutions of learning to counter and reduce tobacco usage, especially among the young people. Katiritimba made the remarks in commemoration of the World No Tobacco Day running under the theme "Commit to Quit," and appealed to government to strengthen laws governing tobacco usage in Uganda.
Tobacco usage is the main underlying risk factor for non-communicable diseases such as high blood pressure, lung diseases and diabetes, among others. Commemorating the World No Tobacco Day, the Executive Director, Uganda National Health Consumers Organization, Robina Katiritimba, said Uganda Revenue Authority must swing in and take action upon illegal products.
And we note that many people are shying away from the products that have graphic warnings, which is a good thing. That people look at the graphic warnings and they are so scared they don't want to buy these products. They are looking for the ones that don't have graphic warnings. So we need to enforce the regulation on graphic warnings. One of the issues is the soft cap. The soft cap is those cigarettes which are in the soft packets, and they are cheaper. They are much cheaper. If you buy Sportsman, for instance, you can buy it at 300, 250 shillings, and government gets only 50 shillings.
The call follows a surprise raid by the Ministry of Health, Kampala Capital City Authority and security operatives in bars, in which they managed to confiscate over 200 tobacco shisha pipes and pots and arresting over 50 addicts. The raid, which health experts say is unstoppable, is part of the activities to commemorate the World No Tobacco Day, while the Health Ministry and KCCA will keep a watch on bars where tobacco usage is rampant, with many teenagers falling victims of drug abuse and turning out to be mental case. Katiritimba says other teams have been established in schools to preach against tobacco usage.
We need government to strengthen the services to reach everybody who would like to quit smoking. There are many people, and the services are not adequate. So we need enforcement, we need establishment and support of existing services for quitting using cigarettes, but we also need taxation. We need regulation that looks at illicit trade of tobacco industry products, and also to tax and ensure that those which come in have followed the regulations, such as graphic warnings.
She says the tobacco industry is taking the advantage of the lockdown to sell its products, but she reveals that advocating for the strengthening enforcement services and taxation in the market trade will be key in the fight against the behavior. Katiritimba recognized that there are a number of smoking activities behind the scenes and asked the population to have knowledge about dangers of smoking.
If you want to reduce the use of tobacco, you need to stop people from the initiation. You stop young people. If all young people would stop smoking.
She asserts that smoking activities are rampant among young people living in slums and attributed it to a lot of products on the market which are unregulated. However, Katiritimba says the Tobacco Control Act has been put in place to protect youth from tobacco usage.
The Managing Director, DFCU Bank, Matthias Katamba, has said that the bank will facilitate the Village Model Social Services Program introduced by Rotary Club of Bunga. He was speaking at the installation ceremony of Samuel Majwega, President of the Rotary Club of Bunga in Kampala.
Changing the lives of needy communities involves providing essential needs like water and health services. The need to transform livelihoods of vulnerable communities are implemented through corporate social responsibility in partnership with groups like Rotary. The fourth president of Rotary Club of Bunga, also proprietor of MK Publishers Limited, Samuel Majwega Musoko, has started his task with the launch of a village model project and installing the entire district Rotary team at Sheraton Hotel, Kampala.
We have started the project at Chiweka Sebobo, Mitiana Road at Busonju, and we look forward to start to build there a health center 3. Then I've started a Rotaract Club, and that Rotaract Club has already achieved the provisional status.
In this, the pledge focuses on programs that target education, health, and water.
Adopted village, where we can do all these projects, some of these projects, to adopt a village so that we solve the problems in that village, from water to education to health for conflict resolution by putting there a police post to economic empowerment, all of those areas, so that we touch the lives of those people in that village. That, in a way, is one of the things I want to start on in my presidency.
Director, DFCU Bank, Matthias Katamba, pledged to partner with Rotary Club of Bunga in extending humanitarian services to the needy. Sudat Kai, Robert Waiter, UBC.